Hello, this is my presentation for integrated cancer care. I chose colorectal cancer, and it's cancer of either the colon or rectum. The first signs of colorectal cancer is usually the growth of polyps. Not all polyps become cancers, but many do over time if they're left untreated. There's a few kinds of polyps. There's adenomatous polyps, and they come in three kinds. There's tubular villus and tubulovillus, and they can sometimes become cancerous. There's hyperplastic inflammatory polyps, and they're a little bit more common. Usually not precancerous though, but if they're larger than 1 centimeter, more screening is needed to keep an eye on them and make sure they don't become cancerous. And there's sessile serrated polyps and traditional serrated adenomas, and they have a higher risk of colorectal cancers. Any polyp is more serious if more than 1 centimeter, or if there are more than 3 discovered. Dysplasia in surrounding tissues after removal is also a cause for concern. So if there's abnormal cells around where, like the margins of where it was removed. The polyps are in the mucosa, but if they're cancerous, they can penetrate the deeper layers of the colon or rectum, depending where they are, at which point angiogenesis occurs. So they start making blood and lymph vessels. Most colorectal cancers are adenocarcinomas, but they can rarely be carcinoid, meaning hormone producing. Gastrointestinal stromal tumors, and that's the interstitial cells of Cajal, although it's pretty rare, lymphomas, and sarcomas. Causes and risk factors. So obesity is a big one, and a sedentary lifestyle is another one. So that's going to be a focus. Diet is another. So something to avoid in diet is red meats and processed meats. And if you're inside a lot and you don't get a lot of vitamin D in your diet intake, or just through exposure to the sun, you're gonna have to make sure to be supplementing with your vitamin D, which we should all do anyway. If you have irritable bowel disease or Crohn's, if you have a family history, or if you have something called Lynch syndrome, hereditary non-polyposis colon cancer is another kind, so you don't develop polyps. And it's a genetic defect that affects the ability to repair damaged DNA, and that also comes with an increased risk of endometrial cancer in women. African American men and Ashkenazi Jews have higher rates of colorectal cancer, so maybe screening earlier would be a good idea if you fit into those categories. And type 2 diabetes puts a person at a higher risk and has a less favorable prognosis. The treatment, I went by stage. So if you're in stage 0, it means that any cancerous polyp has not grown beyond the inner lining, and surgery would be the recommended way to go about this. So to remove the polyp, and if that goes well and there aren't any leftover cancerous cells, then you want to increase your exercise level. If it's insufficient, you want to increase the rainbow of your diet and ensure you have adequate fiber so that you're not leaving things in your colon when you're passing stools. You want to supplement with, and this is going to carry through the other stages also, some of this stuff, supplement with antioxidants and adaptogens. So for antioxidants, you could do grape leaves or olive leaves, Ganoderma, reishi mushrooms. For adaptogen, you're going to want to get an alternative with anti-inflammatory properties, because inflammation in the bowel is something that tends to create polyps. And for that, you could use cleavers, gallium ampurine, fresh in smoothies if possible, because a smoothie will also up your fruit intake. Supplement vitamin D, especially if you have a more indoor lifestyle, as I said. And that moves us to stage 2, which means that the cancer has grown beyond the inner lining, so beyond the mucosa. And the removal of polyp, if it's successful and there's no other cancerous cells at the margin, the same treatment as above. If the cancer is not in the polyp, a partial colectomy might be required, and you'll follow the same protocols as stage 1, basically. You can also put in astragalus, because it inhibits vascular permeability. So if you're in stage 1, you might be moving into stage 2, you might relapse. Then you're going to want to make sure you don't have those weak blood vessels if angiogenesis does occur. So stage 2, often growth through colon walls, and but it has not spread to the lymph nodes. Chemo after is going to be often recommended if there's a high risk of it returning after the surgery. So you might want to include Centella, Gotucola for vascular integrity also at this point. If the patient opts for chemotherapy, try Catu, which is the black pepper, long pepper, and ginger combination that helps you take up nutrients, because if you're starting to have chemo, you're going to have a reduced appetite, and so what you do eat, you want to make sure it's getting in there. You can also add bitters for the same reason. Probiotics might be a good call at this point too. All right, stage 3. So the cancer is spread to the lymph nodes nearby, but has not metastasized to other parts of the body. At this point, surgery to remove the affected section of the colon plus nearby lymph nodes is the protocol, followed by chemotherapy. And most chemotherapies for colorectal cancer involve 5-fluorouracil. So adding Coptis supplement as a supportive role for Ganoderma's lentinin could be appropriate to help the action of the 5-fluorouracil. Okay, stage 4. So stage 4, it's spread to other organs and tissues. Often this is the liver with colorectal cancer. Surgery is now unlikely to cure the cancer, but if there are only a couple of metastases, their removal might extend the patient's life. If spread to the liver, the chemo can be delivered regionally by hepatic artery infusion, because your liver gets most of its blood from the portal artery. So you can go in the hepatic artery, and another thing you can do there is you can actually create an embolism in the hepatic artery to block off the blood supply to the tumor, because tumors often grow around the hepatic artery. Anyway, so at this point, mitigating the effects of the chemo is the most important thing to do, and introducing end-of-life care awareness to the discussion is going to be important as well. Focus on making sure they have good support networks and managing any discomfort. Exercise sort of fades a little bit into the background here in the last 2 stages, but spending time in fresh air and with some sun on your body can work to soothe sort of the mind-body situation. Also, introducing aromatherapy would be good too, because you can start getting some pretty serious nerves at this part of your life, I imagine, and maybe something nice and calming like lavender would be a good addition. Okay, that's more than all the time I have. Thank you for your patience.